Today I'm gonna talk about two things or two outcomes that come from having Botox, and especially for people who just started to have Botox. Sometimes they cannot really understand why they can have some issues with having Botox for the first time at least. So I choose this lady's picture. She's not our client. I got it from Google because it's public and I do not want to use one of ours to explain this. So look at this beautiful lady. Um, she has, if you look here to her upper eyelid, she has this sagginess in her upper eyelid, which I started to have. That's an extra skin. And this extra skin comes because when we're young, we have this skin is nice and tight. When we start to get old, there is loss of collagen here, there's loss of elasticity here. So this one starts to sag down on her eye here. So if I was to inject this lady, I would talk to her and said, yes, you have problem here, which you waited so long to have it done. And this is why even if I do Botox, you're still gonna see it because Botox only stretch muscles, it doesn't fill any deep lines. So I'm gonna make this one softer, and if you kept your Botox back to back, your skin can recover with using good skincare, with doing some peels or lasers. It can improve, but you're still gonna see it. Put expectation where it should be, and you have those forehead lines. So those forehead lines, if I was to treat them, they're gonna look nice and beautiful. Of course, softer than now. But what can happen is this lady, when she wants to wear any eyeshadow or wants to wear any mascara, this is what she's gonna do. She's gonna lift her eyebrows up, and she can stretch this skin, and she can have her makeup. But what happened when this one is relaxed? She's gonna lose the ability of doing so. And then she's gonna come back and say, oh, you know why I cannot wear my makeup? I have always to do this to wear my makeup, or I feel heavy here. I feel like, oh, why I'm having this? I didn't give you this because this is an extra skin. But what happened is because you lost the ability to stretch your forehead up. This is how you feel, that even you can feel like your eyes are looking different. But this happens only for 2-3 weeks, and then you're gonna start to push back again and get things back, and then you can for your muscles, and then it will be softer. So nowadays I said, okay, listen, you got to choose between having those lines or you're having a heavy look. I cannot give you both because this is stretch this muscle, not able to move it up. This was gonna give you this look. But people don't understand. They think that they can fix it, but no. The really fix here is for this lady to have Botox, but she go and have a surgery so she can cut this one. This is why people go for eyelid surgeries and upper eyelid surgery and lower eyelid surgery, because an extra skin Botox cannot absorb it. So this is one problem. The second problem that we get into is the crow's feet. The crow's feet, as you see here, this lady having lines here and have all the lines down to here, because there is two muscles. There is a muscle around the eyes and there's another muscle here. And the only indication that to inject the crow's feet is only to inject around the eyes. We do not inject in this muscle, because if we inject this muscle, things can happen to the face. So you can lose some movement, you can affect speech, chewing, whatever. So we only inject around the eyes. So people come after injection and say, here, I still can see the line. Yes, because you have a muscle here that I did not treat. But when you don't do that, then this thing is gonna look nice and stretched. So I'm injecting only around the eyes, I'm not injecting here. So you have to understand also that when we disable some muscles from working, sometimes it gives you a different look. It's not exactly a weird look, or actually it doesn't feel like a look. It's not like a look, it's a feeling. And especially for the first time, when you disable one of your muscles, you feel like, oh, what happened to me? But honest, if you keep doing your Botox back to back, which is every 4.5 and 5 months max, your lines are gonna improve slowly, and you're gonna get used to the feeling of the Botox, because definitely I am disabling some muscles from working, because when they work, they cause you wrinkles. You got to choose between this, a good look, no wrinkles, or having little bit of tension, or having little bit of a heaviness, or But usually this happens in people older than 50 and older, but young people don't have the extra skin, they have no problem whatsoever. My advice is to start early. One, because you don't want to have your lines getting deeper. Two is, if you were a bit older than 40 or 50 and you have this sagginess, do not blame it on the Botox. It's, you have to blame it on aging more than anything else. Consultations one-to-one are usually more effective, and I can assess your skin and I can assess your eyelids and I can tell you what can happen. But I usually give the warning and I spend the time and go soft, very soft here, trying to avoid this unnecessary trouble. And I can refer you to a surgeon if you still don't like your upper eyelid sagginess. I hope this was helpful, and again, please start as early as possible and keep your Botox back to back. This will make you look younger and fresher. Thank you.